There might be this inner restlessness or trouble settling down in one's mind to relax, or ability to sit still, but discomfort. It's stressful, it's taxing, it takes more emotional energy, right? So it's kind of this, there's still this sense of like internal movement, which may not be visible on the outside, but it is perceived internally. Does hyperactivity look different in adults compared to children with ADHD? I'm Dr. Lewis, I'm a psychiatrist, and let's talk about this topic of how does hyperactivity look in adults, and understanding the differences from how it appears in childhood to adulthood can help in picking up and diagnosing this condition, which, even though it's much more frequently diagnosed, is still underdiagnosed. So in kids, hyperactivity is usually physical activity, right? So that's, think of like running and climbing and unable to sit still, lots of energy. In adults, it looks different, right? So the physical hyperactivity with age transforms into like a more internal thing. So people learn with age to, to regulate or mask, depends how we think about it, compensate, and it's still there. It's just felt inwardly, right? So there might be this inner restlessness or trouble settling down in one's mind to relax, or ability to sit still, but discomfort. It's stressful, it's taxing, it takes more emotional energy, right? So it's kind of this, there's still this sense of like internal movement, which may not be visible on the outside, but it is perceived internally. Children with ADHD fidget and squirm and tap and, do all of that. And adults do some of that, right? Maybe they learn to do it in a more subtle way, right? Maybe it's just like finger tapping or twirling hair or something like that, or tapping a pen, right? Something that doesn't get in the way, because probably they've been yelled at, 20,000 times by now to stop doing whatever they're doing. And even though it's quieter, it's still real. It's still like an expression of an inner hyperactivity, an inner restlessness. So let's not like neglect that. It's still there. Thinking about impulsivity, children might like interrupt others, or, they can speak without thinking and blurt out, an answer, stand up or do something, right? Hasty decision making. Some of that is also present in adults, right? But that could be like a fast decision about ending a relationship or quitting a job, and some trouble with delayed gratification. And sometimes these like quick decisions can be good, but often they can have some negative consequences in the future, if not really negative consequences in the future. Children with ADHD often struggle with like staying on topic at school. On the other hand, adults may find it difficult to focus on work tasks, right? So this can lead to problems with work and productivity, because they may get easily distracted. There might be interpersonal issues that get in the way of work. There might be also frequent career changes, right? So it's very different in adults. Hyperactivity can also show up in speech, right? So in kids, it might be like talking too much or trouble like playing quietly. They're always chatty. In adults, there still can be this hyperactivity in speech. That could be rapid speech or interrupting during speech, talking over others, having a sense that there's so much to say, not enough time to say it all. Also switching topics, or being, not such a great listener in conversations and kind of bringing the conversation to oneself or one's interest a lot, or not really listening and following and kind of tracking what the other person is saying. So that's how it can show up in speech, in language. That's still hyperactivity. And both kids and adults can struggle with switching tasks and transitioning, and adults can end up with this like multitasking mess where like there are 7 different things all happening, and it just feels overwhelming, and none of it like is finished, right? So it's just like too many tabs are open, and it's disorderly. It's not like organized and streamlined, so it's harder to get anything done. And both kids and adults can experience this emotional dysregulation, this irritability or frustration or mood swings, and that can have an impact on relationships and work and many areas of life. Over time, adults with ADHD develop strategies and adapt and find ways to cope. So for many people with age, symptoms of ADHD either go away or they are really well managed, or people figure out how to take care of themselves. There are also some things that are still there, right? And that can be hyperactivity, it's just masked, right? So it's not eliminated, it's not gone. It's not the same child that's like climbing and running around, right? But there's this like inner motor, like this inner restlessness that's still there, and it can show up in speech, it can show up in interactions, in decision making, and how one lives their life. Also, adults with ADHD are more likely to have other mental health conditions. They are more likely to have anxiety and depression than a kid, right? In part because of the impact of ADHD over the years and all this like negative feedback and difficulties. And that interplay of ADHD and mental health conditions is important to recognize in treatment and may require different treatment. So overall, keeping in mind that the hyperactivity in adults and children may look different, and it's still important to pick up, and might be important for an individual to really understand, right? Like if you have ADHD and you notice that, it's like really hard to just relax, right? Or I always have to be doing something, or I'm getting into trouble in conversations with my significant other, or they say I'm not remembering things, right? It's just a moment to pause and see, like, is this hyperactivity? Because that can help you understand what's going on.